Without objection, the gentleman from Illinois will control the time. The gentleman is recognized.
And I thank the gentleman for yielding. And just as a historical note, I think I should point out, when it comes to this issue, there's actually plenty of blame to go around. Because after all, it was in 1988 when a Democratic Congress, voting under the Omnibus Budget Reconciliation Act of 1988, created this problem under the guise of the RVRBS, and it has gone through several names and several acronyms since then, but that's when it began. And it was really a very predictable consequence of Congress's interference in the practice of medicine. 1988, there have been multiple Congresses, there have been multiple administrations, both Republican and Democratic. The opportunity to fix this thing has been there, but it has not been taken. Patching the payment system is extremely unsatisfactory, but the alternative is absolutely unthinkable. Let me tell you just for a minute what it means. In a 1 or 2 doctor office practicing primary care, when the head of CMS holds your paycheck for 1 week, 2 weeks, now 3 weeks, even if you're doing as little as 15% Medicare in your business, that cash flow that's disrupted across the counter means that that doctor's office is likely not going to be able to take a paycheck that month, and what's even worse, they may have to go out and borrow money for operational expenses. I know that never troubles this Congress to borrow money for operational expenses. We do it all the time. But when you're a small business person and you're borrowing for operational expenses, it's extremely frightening because you don't know when you're going to be able to make that up. Now, we have a bill that's retroactive to the first of the month, so those checks will be reissued, and that's a good thing. Unfortunately, the expiration date on this bill is November 30th. As was pointed out previously by the ranking member on the Ways and Means Health Subcommittee, in January or December 31st of this year, a 26% reduction occurs. What happens in early November of this year is that every private insurance company that pegs its reimbursement to Medicare is going to recalculate its reimbursement based on that 26% cut if we don't do something before then. Let us commit with this window of opportunity that we have given ourselves between now and November 30th that we are going to work on this problem. I've had a bill out there some time, H.R. 3693. Yeah, it's problematic because of the cost, but it's not a real cost because we've already dispensed that money to the doctors. The doctors have already used that to run their practices. This is Bernie Madoff accounting that should make any one of us in this body ashamed to continue it. Let's recommit to fixing this problem. Let's redouble our efforts. Let's leave aside the partisanship. I will remind some of the speakers on the other side, I have voted with you on this issue in the past. I didn't like the policy you put forward. I thought it was very bad policy at the time, but it was worth it to me to get this issue solved because our nation's seniors, our patients, our doctors depend upon this. I'll yield back the balance of my time.
Someone yields back.